The Delhi Metro had been transporting millions of people every day until its closure in late March. But on its first day of reopening, the few people on board were relieved the service had resumed.
It has been really difficult because like bus services, we are not sure when next one will be coming. So I feel this has been very relieving for me that like it has started. In metro it's very comfortable and it's very convenient for me.
Metro train services have reopened in most of India's biggest cities, including Chennai and Hyderabad, with limited routes and times to avoid crowding. Passengers must have their temperatures taken before boarding and wear masks while maintaining social distancing. Despite India recording more than 90,000 cases a day, more lockdown restrictions are being eased. Alcohol can be served again in Delhi from later this week, which comes as a big relief to restaurant owners who say they've lost at least a quarter of their revenue while a ban was in place.
Everyone who comes on the table, they're ordering food, they want something to go along with it. And with families, the elders, they want to drink along with it. So we've lost about 25–30%. So we'll get something coming back over there. But, the other players who are like more alcohol dependent, like their restaurants can't open up till this starts, till it opens up again. So it's like a big hit for those people.
It's because of the lockdown's impact on the economy that the Indian government is continuing to ease restrictions. But while cities are slowly returning to normal, the virus is spreading to India's remote villages. More than half of all of the COVID-19 cases recorded in August came from rural districts. 65% of India's 1.4 billion people live in rural areas, but the less developed hinterland has only 20% of the country's doctors and 40% of its hospitals. Doctors say that's a big concern.
First thing, that they are not getting to a proper healthcare professional, first thing. Second thing, even if they reach a proper healthcare professional like at primary health center or at community health center, there the facilities are not appropriate.
The divide between India's cities and villages has always been big. Health experts say it's now imperative to bridge that gap by spending more on rural healthcare if they are to get the coronavirus under control. Elizabeth Puranam, Al Jazeera, New Delhi.